Hello, my name is Yana and I'm going to be your nurse today. Could you tell me your name and your date of birth, please?
Alex Maldonado, 6/29/94.
Alright, and Alex, what brings you in today?
Just a physical checkup.
Perfect. So Alex, can you tell me where you are right now?
Doctor's office.
And can you tell me what year it is?
2024.
Perfect. So patient is alert and oriented ×4. So really quick, just for your background, is there any medical history we need to know about?
I am an asthmatic.
And then any allergies that we should know about?
I'm allergic to ibuprofen, penicillin, and morphine.
Alright, and then what is your occupation?
I'm a landscaper / gardener.
Alright. So Alex, since you are here for a physical, I'll be performing a full head-to-toe assessment on you. Is that okay?
Yes.
Perfect. So I'm going to do some hand hygiene. Alright, so starting the exam is, I'll be starting on your head, okay? So let me know if there's any pain. So head is normal cephalic with no bumps, lesions, or any deformities noted. If you could look right at me, I'm going to be shining a light in your eyes, okay? Really quick. Alright, perfect. And then if you could just look straight. Alright, perfect. So pupils are equal and round and reactive to light, and they accommodate bilaterally. Conjunctiva is pink, and his sclera is white. So have you had any trouble with your sense of smell lately?
No.
Alright, perfect. So I'll just be assessing your nose now. So your sinuses, any pain? Any pain?
No.
Alright, so sinuses are normal, no swelling or tenderness noted. And can you look up for me, please? I'll be looking this side. Perfect. Look ahead. And then if you could plug one nostril and take a deep breath in and out, and do the same on the other side. Perfect. So nares are patent bilaterally, and septum is non-deviated with no shift. No lesions or rashes noted to both his to bilateral nares. So now I'll be checking your ears. Any ringing or hearing loss experienced lately?
No.
Perfect. No redness or drainage noted to both ears. So now I'm going to be looking inside your mouth. Go ahead and stick your tongue out and say ah. Perfect. Alright. So uvula rises up and down and is midline. Tongue is pink, moist, and is midline. Buccal mucosa is pink and moist with no lesions or cuts noted. There are no obvious tooth decay or cavities at this time. Gums are pink and moist and have no bleeding to them. And lips are pink and moist as well with no lesions and cuts or rashes. So now I'll be palpating around your neck, meaning I'm just going to be feeling, okay? Perfect. And now I'll be feeling for your carotid pulses. Alright. Lymph nodes are not swollen. Carotid pulses are present bilaterally +2. No signs of jugular vein distension. Now, so I'm just going to check for your range of motion. So can you look to your right for me, and to your left, and then up and down. Alright, perfect, thank you. So patient has full range of motion to his neck. Did you have any pain while you were doing that at all?
No.
Alright, perfect. So now I'm going to be moving on down to your lungs. Any problems breathing, any shortness of breath lately?
No.
Perfect. So I'm just going to listen to your lungs and then just breathe normally for me. So lung sounds are clear bilaterally to the anterior chest. And so if I can have you just turn around for me. Thank you. Perfect. So I'm going to be listening to your lung sounds back here, okay? So just breathe normally. Thank you. Really quickly, 1 second. And I'm just, so lung sounds are clear to bilateral lobes on the posterior side of the chest. So now I'm just going to be checking for respiratory expansion. So go ahead and just take some deep breaths for me. Perfect. And again. Perfect. All right. And then now, so respiratory expansion is symmetrical to the posterior chest. And now I'll be palpating the posterior thoracic cavity. Let me know if there's any pain, okay? All right, perfect. Go ahead and turn around for me again. Thank you. All right, so now I'm going to be checking for respiratory expansion on the anterior side. So go ahead and just take some deep breaths. Again. So patient has symmetrical respiratory expansion to the anterior side. And now I'm just going to be palpating your anterior thorax. Let me know if there's any pain. Okay?
No.
Perfect. All right. So now, so lung sounds were clear again bilaterally to the anterior and posterior sides of the chest. And no adventitious sounds were noted. So now we're going to move on to your cardiovascular system. So meaning I'll be checking for your heart rhythm and I'll be listening to your heart sounds, okay? But before I move on, have you had any recent cough or anything like that?
No.
Okay, perfect. All right, so now we move on to your heart. Any abnormal heart rhythm or anything abnormal with your heart at all that we should know
Nothing.
about? Okay, perfect. All right. So first, let's listen to your. So S1 and S2 is regular, no murmurs or extra heart sounds noted. So we already felt for your carotid pulses earlier, so now I'm just going to check your temporal pulse. All right, temporal pulses present +2 bilaterally. I'm just going to check your brachial pulse and your radial pulse. This side. Alright, so brachial and radial pulses are present +2 bilaterally. And I'll be checking your pulses on your lower extremities. So inguinal pulses are present +2 bilaterally as well. Checking for popliteal pulses. Posterior tibial pulses. I'm going to just have you take off your shoes slightly. you. Checking for pedal pulses. So pedal, posterior tibial, and popliteal pulses are present, plus bilaterally as well. And then I'm going to check for your fingers, your refill. Okay. So. Perfect. And then can I check your toes also? I'm pretending to take the socks off. Capillary refill is less than 3 seconds to both fingers and the toes. So now I'm going to be moving on to your abdomen area. Really quickly, can I ask when your last bowel movement was?
A few hours before coming in.
Okay, and then have you had any abnormal bowel movements, any constipation or diarrhea?
No.
And then have you had any trouble urinating lately?
No.
Okay, perfect. So I'm just going to feel for your abdomen, okay? I'm going to palpate that area. Let me know if there's any pain. So abdomen is soft, non-tender, non-distended. Now I'm going to be listening for your bowel sounds. Perfect. So bowel sounds are normal, active, and present to all 4 quadrants. I'll be assessing your abdomen now, lifting up his shirt. I can see that the umbilicus is midline, and I see no obvious deformities in his abdomen. So let's see. And then patient does not complain of any pain or tenderness to his abdomen as well. So now moving on to your musculoskeletal, meaning I'm going to be assessing for your range of motion in your extremities. So if I can have you stick your arms out in front of you. All right, perfect. And then flex your arms backwards. Perfect. And then out in front of you. And then roll your wrists around. Perfect. Are you having any pain at all?
No.
And if you can go that way. Perfect. And then have your arms to your side. And then straight above your head. Perfect. Any pain?
No.
All right, relax your arms. And then if I could have you stick out both your your legs, and then have you roll your ankles. Any issues there?
No.
All right, go ahead and relax. Any pain in your joints or anything like that?
No.
Alrighty. And do you have any history of breaking any bones or fractures?
I had broken, fractured, sprained quite a bit when I was younger.
All right, and do you have any problems now related to that?
No.
Perfect. So now I'm going to be moving on to the neurological side. So we have determined that patient is alert and oriented times 4. So now I'll be needing to assess your gait, meaning I'm going to need you to get up and then take a few steps towards the camera, and then if I can have you come back and sit down, please. Perfect. All right, so patient's gait is coordinated, no imbalance noted, and patient remains good posture while walking and standing, no obvious deformities to his spine. And then I'll be assessing your reflexes now. So this is my hammer to check for reflexes. All right. Perfect. Perfect. Perfect, thank you. So reflexes are intact to bilateral upper and lower extremities. So this next part, I'll be assessing for your pain sensation to both your arms and your legs, okay? So I'm going to be poking with a pin. There's a sharp side and a dull side, so all you need to tell me is sharp or dull, okay? And this shouldn't hurt. It'll just be a quick little poke, okay? Close your eyes for me.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. sharp, 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 dull, dull, sharp,
All right. On the other side.
dull, dull, sharp, 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 dull, sharp, dull, 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 sharp, sharp.
All right. Thank you. Now we'll be doing your legs. Make sure you keep those eyes closed.
Dull, sharp, sharp, dull, dull, sharp, sharp, sharp.
Okay. Put your shoe back on. Other side.
Dull, dull, sharp, 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 dull, dull, sharp, dull.
Okay, perfect. Thank you so much. All right, so pain sensation is intact to all 4 extremities. Let's see, and now we'll be moving on to your skin. So, patient's skin color, upon visualizing at this time, appears normal to his ethnicity. Skin is warm to touch, but no sweating, no diaphoresis noted, no cool, clammy feeling. Excuse me. Skin turgor, checking for skin turgor. Skin turgor is good. No tenting noted at this time. Have you had any recent sunburn or anything like that lately?
No.
Okay, perfect. Let's see. So upon visualizing the patient, I don't see any lesions or rashes or any cuts or lumps. Upon assessing all other body systems, at this time, my assessment is done. So because he works outside, patient education that I would provide for him is to encourage use of sunscreen and to maintain adequate hydration while he's working, and to just make sure to put on lotion to keep your extremities moisturized and to prevent any dryness. And yeah, that's pretty much it. Do you have any other questions for me?
No.
All right, perfect. I'll be taking off my gloves. All right, thank you. And that's it.
Thank you.
Oh my gosh, I hope that was good.